Welcome to COVE Course, a multidisciplinary approach to understanding the pandemic, coming to you live from the University of Illinois in Urbana-Champaign. My name is Eva Pomerantz, and I'm the Acting Director of the Center for Social and Behavioral Science, one of several units on campus which has contributed to the design of this course. It is my pleasure to introduce this Sunday's evening session, and with it, some of the thinking behind the experience we have created for you. The COVID-19 pandemic has created an unprecedented public health crisis of proportions so huge that you can really only grasp them by taking a 360-degree view of what's happening. At Illinois, this kind of kaleidoscope approach is our signature. Over the course of this semester, you're hopefully gaining a comprehensive, multidisciplinary understanding of the pandemic. The course guides you through past, present, and future perspectives on the what's happening now, with weekly topics that range from history, biology, and business to data security, racial disparities, mental health, and more. Our speakers and moderators, world-class scientists, humanists, social scientists, artists, and community partners will share their knowledge and insight on many of the factors and conditions we are reading about but want to know more deeply about. Individually and together, their presentations will showcase how interdisciplinary research and expertise can offer unique perspectives on this global health crisis and its consequences. Here at Illinois, we operate on the assumption that the best way to stay safe is to learn more about the pandemic and its many dimensions, and to come together as a community at this time of crisis and uncertainty. This program was built with support from the Office of the Provost, the Carl R. Woese Institute for Genomic Biology, the Center for Social and Behavioral Science, the Humanities Research Institute, the Institute for Interdisciplinary Health Science, the Seibel Center for Design, the College of Liberal Arts and Sciences, and the Granger College of Engineering. I speak for all my colleagues in those units when I say we are delighted to see you and to be able to bring such distinguished speakers to the table. Before I introduce this evening's guests, and because we are broadcasting from Urbana-Champaign, we would like to acknowledge that we are on the lands of the Peoria, Kaskaskia, Piankashaw, Miami, Mascoutin, Ottawa, Sauk, Meskwaki, Kickapoo, Potawatomi, Ojibwe, and Chickasaw nations. These lands are the traditional territory of these native nations prior to their forced removal. These lands continue to carry the stories of these nations and their struggles for survival and identity. As a land-grant institution, the University of Illinois has a particular responsibility to acknowledge the peoples of these lands, as well as the histories of dispossessions that have allowed for the growth of this institution for the past 150 years. We are also obligated to reflect on and actively address these histories and the role that this university has played in shaping them. This acknowledgement and the centering of Native peoples is a start as we move forward for the next 150 years. For information on how Illinois celebrates Indigenous Peoples Day, which is on October 12th, please go to the website of the Office of the Vice Chancellor for Diversity, Equity, and Inclusion. Our speaker this evening is Professor Tara Powell. Tara Powell is an associate professor in the School of Social Work. Her research explores the mental health impact of collective traumas, including wars, natural disasters, and pandemics on children, families, and communities throughout the United States and internationally. Since beginning her career, Dr. Powell has developed numerous evidence-based interventions for children and care providers affected by collective traumas. She has worked closely with global humanitarian organizations to disseminate and research these interventions. Dr. Powell has also been responding to the COVID-19 pandemic, providing courses on self-care, supporting distressed children and youth, and grief and bereavement. She is also leading a study examining frontline healthcare providers' experiences working with COVID patients in field hospitals in New York City. Dr. Powell will use the first 25 to 30 minutes of this session to describe mental health conditions broadly and discuss increased rates of mental health problems during the COVID-19 pandemic. This session will also introduce the cycle of mental health during collective traumas, such as pandemics, and provide resources and strategies to support individuals who are experiencing distress during COVID-19. Our moderator tonight is Professor Karen Tabb Dina. Dr. Dina is an associate professor in the School of Social Work. She teaches on the topics of health policy, organizational development, and public health, social work at the undergraduate, master's, and PhD levels at the University of Illinois. She is internationally renowned for her health disparities scholarship and identifying mental health problems as risk factors for maternal morbidity and mortality. She won the Robert Wood Johnson Foundation's Premier Thought Leader Award for her publication record in 2019. She currently leads 2 patient-centered outcomes research institute-funded projects to engage rural and pregnant stakeholders in depression research during COVID-19. And now I'd like to turn it over to Dr. Powell.
Great. Thank you so much, Dr. Pomerantz. I'm very excited to be here with my colleague, Dr. Karen Tabb, this evening to talk about such an important topic of mental health during COVID. So we'll start off the beginning of this evening with a PowerPoint presentation that I'll walk through, and then the second half of this course, Dr. Tabb and I will interact and talk about some of the questions that you all had. So I'll go ahead and share my screen. All right. Can everybody see that okay? Yeah? Okay, great. Thank you so much. So I'd just like to start today with a grounding breath. So we're going to start with a grounding breath. We'll begin this course with a grounding breath because it can really bring us back to the present and really help us reduce stress. So this is a strategy that you can use yourself, but also to help others when they're feeling overwhelmed, to help them bring them back to the present. So as we begin, what I'll have you do is just sit or stand in any position that's most comfortable for you. And when you're comfortable, we'll start with our grounding breath. First, have everybody take a deep breath in for 1, 2, 3, and then breath out for 1, 2, 3. And as you slowly breathe in and breathe out, notice the rise and the fall of your belly. Continue slowly breathing in and breathing out, just becoming aware of your surroundings. For this next breath in, I'll have you notice all the sights around you. Notice the colors or objects in the room that are around you. And then slowly breathe out. Again, slowly breathe in. Notice all of the sounds in the room you're in, maybe the sounds from outside, and then breathe out. And on your next breath in, notice all of the sensations you feel. Notice how your back feels against the chair, or your feet feel on the floor. And then slowly breathe out. And then finally, with your last breath in, notice the smells that are around you. Maybe the smells from dinner, or any other smells that may be in your house or in your room. And then breathe out. As we continue with this hour, just want to remember that we're going to be talking a lot about mental health and how we can support each other, how we can support ourselves, and also some of the mental health issues that are really prevalent in COVID and what we're seeing as this pandemic continues. So, as we mentioned, there's a few learning objectives that we'd like to cover during this hour. So first, as Dr. Pomerantz mentioned, discussing the cycle of mental health during collective traumas, what we know from the research, how it looks different now with COVID, and what we can expect also. Also, we'll go into what are mental health conditions during the pandemic? What do we know from the emerging research? I'll also go into some resources and strategies to how you can support yourself and how you can support others' mental health during this time. And a very exciting part of this is we'll review your submitted questions as it pertains to specific populations that may be experiencing mental health issues right now, and they may be specifically or significantly heightened because of the pandemic. So, what I'd like to start off with is just talking about the typical disaster mental health cycle. So, as was mentioned, much of my work has focused on natural disasters. I've also worked in a number of different settings in longer term complex emergencies. But this cycle that I'm showing right now it's the typical response cycle of how we work through disasters emotionally. So what you'll see on the left-hand side is you'll see these emotional highs and these emotional lows. And generally before a disaster, communities and individuals are really doing okay. They're kind of about in the middle. And then there's this pre-disaster period. There's this warning and there's this threat. It causes a little bit of anxiety, heightened insecurity, uncertainty about what's going to happen. And then there's the impact. So when the impact happens, we start to experience more emotional lows. But after the impact, what you'll see is you'll see that our emotional highs go way up. As a community, we are there to support each other. There's high community cohesion. I saw this when I was working in Hurricane Katrina after the city opened back up. People came together to really support each other. But then as the recovery goes on, there's this disillusionment phase. And during the disillusionment phase, there are so many stressors that go on. It's not necessarily the disaster itself, but it's all of these secondary adversities. So it could be being displaced from your home, dealing with rebuilding, loss of loved ones, dealing with the grief that a person may have experienced from the disaster. But then you see the reconstruction phase. And during the reconstruction phase, our emotional highs go back up. And what you can see here is at the end, you're actually a little bit better off than you were before. And that can be attributed to resilience and post-traumatic growth. So now what I want to cover is what does the mental health cycle look like during COVID? So before COVID, as you'll see, we were around in the middle, kind of where normal communities are. And then there was the threat of COVID. And a lot of uncertainty was arising, a lot of fear was arising. And emotionally, it was a challenging situation, a challenging time. And at the beginning phase, we saw a lot of communities begin to bond and rise together. And I've really seen that throughout the entire pandemic. And so that's kind of an ongoing, an ongoing characteristic of this pandemic that looks a little bit different than it might in a normal disaster. But what's happening with COVID is we're still in the impact phase. It's not just a one-time disaster like a hurricane. So we're still in that cycle. So you'll see we've had more emotional highs and lows. We go up and down. Every day is a little bit different. Some days you might be feeling okay, some days can be harder. And, that's due to also a number of other issues, such as quarantine fatigue. There's also social issues that are going on in our wider community, social unrest, political challenges. And right now we're in disaster season, so these natural disasters keep happening. So we're in this ongoing phase. And there are so many difficulties that people are experiencing right now, such as stress, uncertainty, and fear, and among many, many, many others. So I've been doing quite a bit of work with COVID, and from the work that I have been doing with different community members, I've really seen so many stressors that people are experiencing that are really impacting our mental health. So, like many other disasters, it's not just the pandemic itself that's causing mental health issues. The pandemic itself can be, but there's also all of these secondary adversities, such as social isolation, job loss, stress around having our basic needs met, childcare, relationships with friends and families, separation, loss and separation from loved ones. So there are just quite a number of different issues that we're all experiencing. And one person may be experiencing a very different issue than another person. So now I just want to talk a little bit about mental health and collective traumas. So there are a number of studies that have reported increased rates of stress, post-traumatic stress, depression, anxiety, fear, and anger in the general population. Major depression rates, for example, have went up 7%. There's also an annual stress survey that's done among US adults. And what it found is that stress levels have significantly increased since the pandemic began. So in the US, there's been increased reported frustration, 40% increase, 24% increase of fear, 18% increases of anger. And also, a recent study found that 13.3% of adults have reported new or increased substance use as a way to cope with the stress of the virus. There's also been an increase in thoughts of suicide. So 10.7% of adults have reported thoughts of suicide in the past 30 days. There are a couple other mental health challenges that can happen in collective traumas that I would like to mention. So one is cognitive dissonance. So that can actually also impact our mental health. And so the cognitive dissonance that's happening here is it really happens when people are trying to make sense of something by explaining information, say, for example, about the virus away, such as refusing to believe that the pandemic is actually real or that the virus is actually somebody else's fault. And this cognitive dissonance can actually cause higher stress and higher distress and uncertainty. And then survivor's guilt is also very common in mental health and collective traumas. So survivor's guilt happens so often. And what it is, it's when a person feels guilty for experiencing distress, but they may have not have contracted the virus itself. They may say to themselves, I shouldn't be stressed because, I haven't had it as difficult as other people. And so really what that is it's a feeling that a person shouldn't have distress because they haven't been impacted. And one thing that I'd like to stress through this is, you know, we're all going through we're all going through this virus. And so even if you've been impacted in a different way or a different level, it's okay to experience distress at this time. So this is just a visual of different mental health symptoms during COVID, and you can see the rise. So what you can see is average daily rates of depression and anxiety in May were quite a bit lower than what they are in July. So we've seen these rates go up. And May, you can notice the pandemic was actually still happening and we were in it. But that's really that disillusionment phase where we're seeing such an increase, such a rise in these mental health challenges because we're going through this ongoing impact. So there are so many different ways that we can experience stress in general, but during COVID are extremely heightened. So there's the physical reactions, so the body reactions. I've talked with many people about how, they feel like it's easier for them to get sick, or they're having weird reactions to their body and they don't know why. Um, I had one person that I worked with that said that they broke out in hives. They said, well, I think that's a stress reaction. Then there's the emotional reaction. So that's those feelings, so intense and unpredictable feelings. Say being angry, really easy, or crying, or feeling very sad. And one day you might feel okay, and the next day feel a lot more, much more down. Then there's cognitive. So that's forgetting, forgetting where your keys are, forgetting something that you're supposed to do. And that's just a really common reaction to stressors in collective traumas. And then there's behavioral. And so those are actions that we take. So in terms of behavioral actions, these can be heightened substance use. I know there's a lot of research that's been done showing that adults are drinking a bit more than they may normally have. And that's a way to cope with the stress. And then there's spiritual. And so those are beliefs and values. So in terms of the beliefs and values, you might question those at a time when there's a lot of uncertainty. And then there's the social interactions. So specifically during COVID with quarantining and social distancing, we're not having the same social interactions that we normally have. So I do want to talk a little bit about suicide and COVID because I mentioned there was a heightened rates of people who have suicidal ideation or suicidal thoughts. One thing we don't know yet is exactly how big of an increase or if there is an increase. The data is still emerging and there's not actually a clear connection, but we do know that the emotional toll of the pandemic might lead to, it actually definitely is leading to exacerbated mental health difficulties, hopelessness, and thoughts about suicide. But we don't know the data yet about if there are increases. We also had a question about mental health of those who've contracted COVID. So there's been a few studies that have been done, and what they have found is that people who were in the hospital with more severe COVID symptoms had very high levels of post-traumatic stress, up to 96.2% of clinical levels. And then also heightened depressive symptoms. So 29.2% of those had very high depressive symptoms. Now in the general public, that's much, much lower. So there are also a number of vulnerable populations to the pandemic and to the mental health challenges with the pandemic. So some groups may be more vulnerable than others to the psychosocial effects. So for example, there's the people who contract the disease, those who may be at heightened risk for it, such as older adults, um, people with compromised immune functions, people with pre-existing medical conditions or pre-existing psychiatric difficulties or substance use problems. And then also, even though children are not more likely to have the severe physical impacts of the virus, they also are at a high risk for mental health difficulties as well. And I also want to mention essential workers and healthcare workers. So there are so many people that are at increased risk. So within the vulnerable populations, there's the risk of physical health. There's also the risk of getting basic needs met. And then a lot of those can lead to behavioral and mental health challenges. Oop, skipped a slide. Okay, so I have talked a lot about the challenges in mental health, but there's also an upside. So after a collective trauma, and we see this a lot with wars and also with natural disasters, is that there is a recovery. And so after a trauma, after people grow higher resilience. And so resilience is really that ability to quickly recover from difficult experiences. So having supportive networks can really help you overcome the traumatic experiences and grow stronger. So having resources, having family, friend networks, community networks can really help you overcome the trauma of such as the COVID-19 pandemic. And then there's post-traumatic growth. So after a trauma, after specifically a collective trauma, there's been a lot of research that's been done. And what has been found is that these really pretty traumatic experiences can really lead to positive change, such as recognizing your own strength, improved relationships, a greater appreciation for life. And a lot of times this just happens naturally. When we go through adversity, we also go through growth. And then there's collective healing. So that's when we're all healing together. And, you know, the pandemic has went on for quite a long time, but if we work as a collective and communities, we can really process the events and grieve and take action to help each other heal. So, as was mentioned, much of my work really centers on mental health and disasters, but a lot of the focus that I look at is researching protective factors. How do we mitigate the mental health issues or difficulties that people may have when they are experiencing a pandemic? So I, along with many other researchers, have consistently found specific factors that influence mental health outcomes in mass traumas. So there's the community level, and there's the individual level, and there's also other levels as well, the family and that meso level. But with the community, just sharing experiences with each other, learning from each other, supporting each other and providing each other compassion. And then at the individual level, normalizing the stress, looking towards the future, having social support, being compassionate for yourself, and having healthy coping strategies. So I recently completed a study with the frontline health providers who worked in the field hospitals in New York City during March and April when the pandemic first hit. So similar to other studies, ours have found that significantly lower levels of post-traumatic stress symptoms were related to higher levels of social support. So those who felt like they were more supported had lower levels of stress reactions and post-traumatic stress symptoms, and social support meaning such as a feeling that there's people you can depend on if you need help, and also having somebody to talk to during difficulties. We also found that coping styles such as reaching out to others and taking action to try to make a situation better also protected against post-traumatic stress symptoms. But on the flip side of that, what we found is that coping styles such as denial of your ability to cope or that the virus was happening, substance use, behavioral disengagement such as trying not to cope at all, were correlated with higher levels of PTSD, post-traumatic stress, and anxiety. So I want to go back to talking a little bit about how we cope. So going back to how we respond, our stress responses, there's also a number of ways that we can cope. So there's the physical, and there's been a lot of information about this on the media recently as we've been going through the pandemic. How do we cope with this? So as I mentioned, physical, so that's exercise, sleep, relaxation. social, so that's reaching out to others, connecting with support systems, uh, connecting with people who you feel comfortable with. Then there's spiritual. So spiritual meaning just connecting with your sense of purpose. Behaviorally, following a healthy diet, reducing alcohol and drug use. Cognitively, just writing down a list of goals, writing down gratitudes that you have, brainstorming solutions to challenges. And then there's emotional, so meditating, just doing a grounding breath like I did at the beginning, and also reframing some of the challenges that you're having or difficult situations. And before I go into the conversation with Dr. Tab, I just want to talk a little bit about how we can support distressed individuals during COVID-19. So there are a few steps that we can take. There's recognition, there's acknowledgement, there's compassion, and then there's offering support. And I'm going to go a bit more into detail about all of these. So in terms of recognition, one first step is just letting a person know that you've noticed a change in their behavior in a respectful, calm, and patient way. Such as if you notice somebody's feeling a little stressed, just say, I noticed that you've talked about feeling stressed lately, or I noticed that you seem down lately. And just recognizing can really open up the doors for people to be able to feel safe and comfortable talking with you. Then there's listening and acknowledging. So that's listening without being distracted and just really allowing people for time to express themselves, letting them know you hear and care about what they're saying, acknowledging their concerns and experiences, just hearing and saying, hey, I know that's a difficult time in your life, or I can imagine how tough this might be for you. And then there's conveying compassion. So connecting with a person by listening, remembering that you're there to provide them support and trying to understand how they may be feeling, letting them express themselves without judgment, and letting them know their feelings can be reasonable or reasonable given what they're experiencing. Just normalizing a stress is so important. And it's normal for us all to feel stressed during this time. It's just saying, it's normal to feel stressed and, I'm here for you. And then finally is offering support. So when somebody is distressed, you don't have to feel like you have to provide them a solution, but you can offer them resources. Don't dismiss your observations because somebody else might not be checking in on them. Somebody else, not thinking somebody else will deal with them because somebody else might not be. And if you don't know, ask the person, what is your support system? Specific questions you can ask, is there anything that might help you feel safe? Can we talk about resources that might be helpful for you? And for example, are there a few people in addition to me that you could ask for support? So finally, before I move back to the discussion with Dr. Tab, I do want to talk a little bit about when to refer somebody to additional help. And we will have a resource list for you, for everybody to be able to see in case they need additional resources. So an individual might need additional help when there's threat of harm to their self or others. They have ongoing distress that doesn't go away, or serious mental health symptoms that need attention. And we may not always know when somebody is having a difficult time, but just checking in is so important because we know how protective social support and feeling like there's others there to care for you can really buffer against mental health issues. So I'm going to go ahead and stop sharing and stop there. And I will bring Dr. Tab back in, and we are going to have a discussion about the questions that were asked.
Well, I just want to thank you for your presentation. That was a wonderful and very thorough overview of mental health problems during COVID-19 and what our nation and other nations are facing as we see the mental health problems and patterns are similar. and other industrialized nations. I think for myself, and I know other viewers are wondering too, about your research. As you mentioned small pieces throughout,
Mhm.
I'd really like to know what are the major issues that are currently affecting the populations that you work with?
Yeah, absolutely. So, two of the big populations that I work with is one, I work with children, so children and adolescents, and that's really where my research started. So, post Katrina, working in schools, and so I've continued that work and it's expanded to COVID. So, one of there are a number of issues that I've seen with children. Um, so, one is regressive behaviors. A lot of children are experiencing fear. Uh, I know that a lot of children are experiencing uncertainty. The disruption in their routines is so challenging, and not knowing what's going to happen. And this is different depending on developmental age. And so, younger children tend to be a bit more clingy to their parents, may have more regression. Older children, say adolescents, are having a lot of difficulties, just missing those milestones with school, feeling isolated, not feeling like they can be around their peers. And this is happening with younger children as well. And so, one thing in terms of my research, what we're doing is it's really changed quite a bit because of COVID. So usually I work within schools and provide social emotional programs for children. But you can't do that now. And so I've been working with colleagues to develop virtual models of social emotional programming to bring children together, and so that they can talk with each other and so they feel like they're supported and can share their experiences. So that's one population.
What's the expected outcome of that?
Well, so we are looking at a few different outcomes. So we are looking at mental health outcomes, so anxiety and depression.
Okay.
We're not sure how much PTSD symptoms we're going to get in children because it's a little bit of a different type of disaster. But also we're looking at connectedness with peers as an outcome, and also reduce emotional distress and acting out behaviors, so behavioral problems. Um, yeah, so that's actually a big population that I work with. And I'll just briefly talk about the other population that I work with, and that's care providers.
Okay.
And so with care providers, what we're noticing is much higher levels of distress.
These are healthcare providers.
Healthcare providers, yeah, healthcare and social service. So I work with both, yeah. Um, and so it's different with healthcare and social service providers. But what we are noticing is just much higher levels of distress, burnout. Um, but also with healthcare providers, one thing that's super interesting is we've noticed much higher levels of compassion satisfaction, depending on the provider and depending on their experience, which actually is a protective factor against post-traumatic stress. So yeah, but actually, so differences in research is we can't go in person to collect any data. So everything is being done online. All of the interviews we're doing are done through Zoom. All of the data is collected virtually. So it's much different, but I'm also doing online webinars for the providers to really try to reach them, and they seem to be going really well. They appreciate having that support. So actually, I just want to ask you to kind of flip it over to you because I know you work with a lot of um, populations that are similar but different to mine. What have you noticed
I
in
mean, we
terms of,
overlap a lot,
we
right?
do, yeah. Hmm.
Especially thinking about the first 1,000 days, so that period
Yeah.
of pregnancy through a child's earliest time of life.
Hmm.
For me, thinking about the question, major issues facing the populations I work with are social support, so lack of social support, lack of referral to resources, uncertainty around telehealth. So most of our work works with women who are pregnant or have recently delivered and or adopted an infant. So we call them perinatal women. It's a period from pregnancy to 12 months postpartum. And COVID has presented a number of challenges where when women go to deliver the infant, usually in a hospital setting, they can only have one support person with them. This compromises any relationship they might have had with a doula or external family members that they wanted to be in the room. They can't be there. So the social support is compromised. The support person can't leave. There are all these relationships that are different and guidelines that are set in place to protect other patients in the hospital, making the birthing experience itself challenging. And then the way that women receive services, it's different. So those who needed social services in addition to healthcare services are doing this virtually now. Not having as many prenatal care visits, not having as many postpartum or well baby follow-ups because these are all tele or even delayed. So things are different and it's affecting my population in a really bad way. Prior to COVID, 1 in 7 women had some sort of depression during the pregnancy or after delivering. Now that's as high as 1 in 2. 1 in 3 to 1 in 5 women experienced anxiety, and now that's as high as 3 in 4. And then for women of color in this country and in Canada, things are that much harder. So we're seeing, same as your populations, around post-traumatic stress. We're seeing heightened post-traumatic stress around perinatal women for the experience of childbirth. And then this new concept of pandemic-related distress and risk for infection. So women carry the burden of worrying about their daily lives if they're going to get infected, but then are worried if they're going to infect the unborn or recently born infant. So there are a lot of challenges.
It's a lot of challenges.
Research? I don't want to take too much time.
No, yeah, this
we're doing differently because this pandemic continues. It's not letting up. So we're trying to identify new ways to work with patients to get better data and improve clinic outcomes. We've been fortunate enough to receive funding to work with pregnant women and their families to identify better practices around depression screening during COVID-19. So we're convening stakeholders. It starts this month in November, or in October and November. And it's different from the past. Before we'd have health fairs and in-person meetings, support groups. We can't do any of that. So it's all online. We use a lot of Facebook and Instagram. But these are things that you don't really think of as a researcher, as approaches to tap into populations and collect data and provide support. But that's what we're doing during COVID.
Yeah, so actually I have a follow-up question on that. So you mentioned social support also, and I mentioned social support quite a bit.
Yes.
It's likely there might not be the research on this yet, but do you know how much of that is a factor in in the distress symptoms?
Social support is definitely measured and compromised social support. So having a home visitor in your home is not the same as having a home visitor on the phone. So again, we're trying to be creative and provide social support in new ways. In terms of measuring them, we know that they don't have the same rich benefit that they once had. These high touch encounters are not happening the way that they once were.
Yeah, I know that's with children that we're working with. They really love the mental health and social emotional programs online that they can be with groups. But a big component of working with specifically young children is bringing play back in. So when children have experienced trauma, one of the first things to go is play. And so trying to figure out virtually how they can connect with their peers and still learn social emotional skills through play has been definitely a big thing that we've had to troubleshoot. And, we're still figuring that out and testing that within schools. Yeah. It's interesting.
Everything's new.
Challenging. Yeah, absolutely.
So I'm thinking about some of the previous COVID classes that we've had in the series, from history to testing and the election. And we are in a climate right now where there's so much uncertainty. From the history lecture, we know that we don't know the full effects of a disaster or a pandemic until many years later. What are some long-standing approaches, some evidence-based approaches to protect ourselves as COVID continues to stay with us and be a part of our lives?
Yeah, so over the long term, what we know is that people are generally very resilient. We, as humanity, have been through significant traumas, from the beginning of time. And so we know that we have the capacity to overcome these traumas and actually do better over the long term. Much of the problems that we experience is when we are feeling stuck. So in terms of evidence-based work, a lot of emotional support work that is done is really to help amplify those healthy coping strategies that people have both in the moment and how they can look forward towards the future. So forward thinking and being able to look towards the future in a positive way is also a very important strategy to building resilience with individuals, but also bringing people together. So, there's a lot going on within our society right now, but if we can find ways to bring individuals and communities together, to have their shared experiences and to support each other, that is also such an important factor in really helping us overcome this and work through the pandemic and all the stresses that are happening.
Thank you. I mean, my mind is moving in 12 different ways from where to take that.
Yeah, it's hard because it's not one specific, one size fits all. This is the exact, you do X, Y, and Z. It's more looking at it as in this more global level of how can we do this? What are techniques and strategies we can do on a community level to bring ourselves back together?
I found that interesting in several of the questions that we received from people who were joining this class. The notion of feeling guilty if you felt that you were in a place where you're resilient, or feeling guilty that you were healthy. And I think within my particular population of study, women are feeling guilty for experiencing joy, right?
Yeah.
Life, and not being able to envision possible selves because plans, however they might have dreamed them to be, are not going to happen with online baby showers or a support person or the birth plan. It doesn't work out. So it creates lots of challenges.
That actually goes right back to the survivor's guilt. So survivor's guilt can look many different ways. So, just feeling guilty that you're doing okay, feeling guilty that you're happy, that also is survivor's guilt. Or feeling like if you are having a hard time, feeling like you shouldn't be because your suffering may not be as bad as somebody else's is in terms of their level of impact, financial or contracting the virus or any of these things. But that's really, really, really common in these collective trauma events.
I'm curious, I wanted to ask you about loss. I know that's a huge topic and we're so limited on time.
Yeah.
I'm thinking about loss as it relates to fear as well. Because right now there's disproportionate loss in this country for Black, African Americans, Hispanic, Latino, Native Americans, Indigenous folks, and even Asian Americans. There's disproportionate loss from the disease, from
Mhm.
COVID itself,
Yeah.
where more people are dying than ever before, where 1 in 1,000 people are going to know someone who's died,
Mhm.
right? Or it could even be a friend of a friend who's died from the disease. So there's this excessive burden of loss
Mhm.
that we nationally are experiencing, and then this collective trauma based
Mhm.
on your racial and ethnic group or membership,
Exactly. Mhm.
and then fear. So it's compounded with fear,
Mhm.
because in this climate of injustice, we have protests across cities across the country
Mhm.
that escalate at different levels, and there's loss within the protest,
Mhm. Yeah.
and then the ripple effect of injustices in this country. So are you able to tackle that at all? Can you speak? I know,
That's a really
right at the end. Are you able to speak to just what you've learned in previous disasters around collective loss? Maybe
Yeah.
if it doesn't impact you directly, but substantial loss within a community, and how to take this forward and to grow from it.
Mhm. Yeah, it's so challenging because you're right. We have, there are so many disparities also that exist within this pandemic. And, you know, one of the things that, unfortunately, I can't talk to how we move the needle on the health disparities because obviously, like, I'm not a doctor or a health, physical health researcher.
Well, it's
Um,
multi-level, and we all have to do something,
yeah,
right?
exactly. So I'm this little piece.
We all do something.
Yeah.
That's
Yeah. So, you know, as I mentioned, and as I think we've seen, I mentioned that community cohesion at the beginning, and you're seeing within many communities this cohesion, which a lot of the community, a lot of the groups you mentioned, a lot of the communities you mentioned have experienced significant loss, significant trauma, and it's not just COVID; it's all of these other issues that are going on within the communities and within our country. But you're seeing this communities come together and support each other, and I think that that's so important, and it's really encouraging to see because that's a way that community can cope with loss and um, can start working towards um, processing the grief that they're going through by having others, by working together, by advocating. It gives people, individuals and communities senses of purpose and senses of moving forward and the ability to look forward. And so, that community cohesion is just so integral in recovery.
yeah. I'm just in full agreement with you.
Yeah. Yeah.
And the full just acknowledgement
Mhm. Yeah.
of the loss that we're all
Yeah.
collectively experiencing.
Yeah. Yeah. It's so interesting because, we've all, no matter who we are, we've all experienced with the pandemic some kind of loss. Whether it be loss of our day-to-day activities on one level, whether it's the loss of being able to see family members that we love and we care about because maybe they had pre-existing conditions. It's
Right.
the loss for them, for those who've had pre-existing conditions from seeing us. Then there's these wider community level factors as well. So there's just so much that we're all going through, and I don't, for any individual, I would recommend not minimizing it for yourself, what you're going through, because we've all experienced something or we're all experiencing something, and we need support and we need resources during this time.
I think this is like really good to end on too, because I'm
Yeah.
scrolling through the list of questions in my head that we received prior to this class, and I think some of the questions were about fear of going to the gym.
Yeah.
Even that could be an experience of loss, or a
Yeah.
vacation that was canceled.
Yeah.
that's okay to experience loss. Like that's okay. That could have been a huge aspect of your life or something you planned for a long time. I
Yeah,
think we would say speak up when you're down is the major
yeah,
takeaway. So
absolutely.
if you're down, if others are down, speak up.
Hmm.
There are supports that are available. There are telehealth options for mental health care. And I just want to thank everyone, and thanks to Tara, Dr. Powell. Amazing work that you do, and thank you for leading us through this lecture.
Great. Thank you so much, Karen.
Well, thank you both, Dr. Powell and Dr. Tab. I learned a lot. I want to let everybody know that there's a list of readings on tonight's topic, and these will be posted on the website course schedule page under this week's topics. And next session, which is on October 11th on Sunday evening again, will be on health inequities with Professor Ruby Mendenhall from the Department of Sociology and Professor Christy Lareth from the Department of Human Development and Family Studies. And we look forward to seeing you all next week. Thank you so much. And again, thank you, Dr. Powell and Dr. Tab.
Thank you so much.